Afternoon, everyone. For those that don't know me, my name is Larry O'Toole. I'm the CEO of LJO Advisors, where we vet and curate some of the most advanced solutions to the marketplace. I want to start off by thanking all of you for joining us today for our webinar that's named Unlocking True AI Potential to Improve Healthcare Outcomes. And, you know, there's a lot of AI content out there lately, a lot of interviews, a lot of panels. What we're going to be concentrating on today is really looking at the pragmatic side of it, right? So we're not going to get into the philosophical, ethical issues and things like that. What we're going to do is we're going to talk about if I'm a hospital system or if I'm an HIT vendor. We look at those as really partnerships in the marketplace. And you've either started down that journey of heading toward automation, leveraging AI or advanced technology of some kind. Like, how do you get started? How do you move, navigate that landscape? What are the tools? What are support mechanisms are out there for you, etc. So it's really what I'm trying to do here is taking a very pragmatic approach to it. And hopefully you'll learn a lot of different insights from my two guests. So, and we'll get into my guests in a moment, but both friends for a long time, and I'm very excited to bring them here with you today. But before we start, for housekeeping, I'd like to just get a few of those items out of the way, just so you know, we've automatically muted folks and no cameras will be on for the audience, but that doesn't mean that you can't participate. So we have a chat box. I encourage you, if there are questions that you have that are pertaining to the content that we have and some of the questions and the dialogue that we're having, please put them in there, because as the conversation evolves, we're going to get to some of those questions. So you will be participants as well as us, but just put it in the chat box and we'll do that. Quick acknowledgement before we get into any kind of intros is that this has been sponsored by my company, LJO Advisors, as well as my partner, NextGen AI, both heavily committed to bringing advanced technology into healthcare and smoothly into the production of provider organizations. Please let me introduce a good friend that I've known for many, many years, Dr. John Halamka, who's going to be my first guest. We're going to split this into two sections. So first, we're going to be learning a whole lot about what John Halamka has been doing, all the good work that they've been doing at the Mayo platform. And John, just so you know, before I even intro you, I've been getting a plethora of questions the last 2 weeks in regards to what is the platform, what are they doing. Great opportunity for you to really, drive home exactly how you're helping health systems and HIT companies. I've known John for many, many years. So I'm gonna ask you to also give into my first question to you, John, to also do a little bit of an intro, because I could go on and on and on. So I'll keep it short. So currently, John is president of the Mayo Clinic platform. The platform is a digital initiative that unites solution developers, data partners, and healthcare service providers to revolutionize healthcare. During 2023 alone, Mayo Clinic platform tools actually in the solutions that they have reached 45 million people. And those who might not know Dr. Halamka, he is a leading figure in healthcare innovation, and I'm really thrilled to have him today. And with that, John, I'd like to give you a little opportunity here to introduce a little bit more of your background, and then we can get straight into question one, which is, what is the Mayo Clinic platform doing? And what you offer as far as helping health systems, IT companies, forge ahead with the investment.
Well, hey, great to see you and great to be here. And welcome from the Delta Lounge, because I don't really live in Boston, I live at Delta. So for the last 4 years, I have worked at Mayo Clinic, working on a variety of technical, policy, and process changes, with the idea that if you're going to collaborate to scale, if you're going to work at the speed of AI, you need to work differently. I mean, Larry and I have worked for years where we establish a project and the first thing you have is 18 months of lawyering. What if you had 18 hours from product ideation to product deployment? What would you need to do? How would you need to change? And so, as you say, so much of what we've done is taken the data of Mayo Clinic, de-identified it, made sure it's consented, put it in a cloud container, and then never sell it, never exfiltrate it, but bring developers, bring companies large and small from around the world together to work on AI to scale. I just left Rochester a few minutes ago, where the Mayo Clinic is hosting 150 investors and a whole variety of companies. And the keynote address, which I moderated, was from NVIDIA. And so, how does NVIDIA start thinking of working with a Mayo Clinic? And what are the things we can do to advance not only AI, but robotics and potentially new tools that no one has really even conceived of yet? So, thrilled to go through questions and details as you wish.
Yeah, I mean, that's a fantastic start. And now that you've kind of introduced the fact that this platform has de-identified data, and millions, by the way, right? Millions of patients de-identified data. Within the platform, I know that you're concentrating on letting HIP companies and provider organizations use that data to build, right? And in addition, you're also helping them through deployment, right? So can you tell us a little bit more specifically about what you're doing? Help them not only test their algorithm, build their technology, but how do they go from that mode into deployment mode?
Well, sure.
How is Mayo Clinic helping with that?
So if one thinks about it, I mean, AI is a life cycle, right? From ideation, well, what algorithm do you want? What problem do you want to solve? To what data do you need to build that algorithm? To once you create it, how do you validate and test it on a different data set? Make sure it works. Effectively looking for bias, making sure it's fair. How do you then get it into workflow? Because, hey, I know, Larry, we'll just create a new app. We'll just tell every doctor, download this app, log in. It's going to be great. Like, never, ever going to work, right? You have to give AI advice in context without additional work, something actionable. And then you need to make sure that you monitor it over time. What did it impact decision making? What was the consequence? Did the patient get better care, earlier diagnosis? And then you keep improving. And so, as you point out, you need the tools to do discovery, validation, and deployment. Now, since Larry and I have worked together for decades, this is not meant to be a judgment on any company, Larry. But all EHR vendors are not the easiest to work with when you say, I've got a brilliant new AI solution. Let's just integrate it into your product. And it's, again, not naming any particular company. It's just sort of generally true in the industry. So the question is, what if you create a container? And you'll find them, and Mayo does this, but others do this. It sits alongside the EHR, feels like it's part of the EHR, understands who's the user, who's the patient, what data might exist on that patient. So in effect, it's giving you AI insights in real time in your workflow as you take action. And what that does for us is it not only Mayo innovations, but any company's innovation, any digital health innovation can be then deployed in the workflow in minutes, not months, and that makes a huge difference in getting impact and use.
Yeah, that alone, provider organizations online are just probably giving the old root right now for that. I mean, anytime that you say you have a new technology that you're introducing and it's going to impact workflow, a lot of hairs go up, right? So being able to expedite that is huge. A lot of my clients, Dr. Halamka, as they're deploying or trying to deploy with a provider organization, going back to something you just said, so I'm pivoting a little bit. You talked about EHRs, right? Specifically, one of the issues that they have is really the integration with the EHRs, right? And trying to get the right data out to feed those components, to feed those AI algorithms, those actionable new technologies that bolt on. We know we've been working interoperability for how long? The last 20 or so years, Dr. Halamka, right? So it's not, made lots of strides, but it's not exactly where it needs to be. I know that you guys are venturing into helping, in that area of, being able to interface and bring the data that's needed that might not be so neatly done within a FHIR app, API, or even in a HL7, ADT message, etc. So, I think that's something that a lot of HIT companies are wanting from the EHR companies is a little bit more, effective, easy to implement integrations. And I know you guys have been thinking a lot about that with how you're helping your partners deploy within provider organizations. How are you guys tackling that now, and where do you see that going in the future?
Sure. So I think you have to think of two components. Again, EHRs are fit for purpose for getting the clinical encounter recorded, getting the bill out, being compliant, etc. But they were never meant to be analytic engines. And so what we find is that you take your EHR data, we put it in an OMOP format, which is an industry standard, international standard, appropriate vocabularies like LOINC, RX norms, SNOMED, that kind of thing. And we then do this not only for Mayo with our 10 million patients, and not only do it for structured data, but do it for the unstructured data, all the text. Do it for the images, the telemetry, the genomics, the digital pathology. And so we today have about 50 petabytes in OMOP, which then we can run analytic tools on top of. And so I tell you that because that's the foundation for building a lot of these things. And we've not only done it for Mayo, but we've done it for Mercy, which is a large Catholic healthcare system, UHN, Toronto, Albert Einstein, Brazil, Sheba in Israel. And now we've brought it to a couple of other partners, Singapore, the country, South Korea, the country, University of California, and others to be added. So there you go, a virtuous global distributed network for AI generation. Once you have the tool, then, as you point out, you need to deploy it. We happen to use the Smart on Fire standard. Again, these are a lot of standards you can go look up. But the Smart on Fire idea is you create this iframe that is adjacent to the EHR and has the capacity using the APIs mandated by meaningful use, the so-called US CDI APIs, the interoperability rule, information blocking rule helped us with that. And now some rules like HTI1 and HTI2 start to give you more hooks, more flexibility, more ways to call external AI products. And so our friend Mickey Tripathi at ONC, working with CMS, FDA, CDC, and other federal agencies, I think you're going to see, with rulemaking to come, a lot more richness to the data availability and the workflow integration we can do together.
Very interesting. And OMOP is something that keeps coming up, obviously, as a standard, helping, let's get to a baseline, right? And I've also hear a lot of conversation once you get to that baseline of the OMOP structure is let's get to a golden standard patient record, right? So you can really be able to go back in a longitudinal way and then be able to see through an entire history of a patient. So you can get more discoveries, more insights at the fingertips, exactly what you're talking about. So as far as where do you think the maturity level, or I should say, where do you think that the adoption level is when it comes to OMOP? You mentioned that you have a number of facilities, countries that are working on that. Is that something that you see Mayo helping their partners get all of them get to? So a couple things, right? Just so everybody understands sort of the Mayo network, right? So you have the Mayo Care Network, right, which are your affiliates that are out there, your proper, and then now you have the platform, right? Is part of the mission that you're looking at is to get all of your partners, if they're within the platform and like HIT companies, or if they're a hospital system that's in your care network, is that something that you guys are working toward to help them get to an OMOP standard?
Well, absolutely. And so I've been in 21 countries so far this year. And when I meet with prime ministers and health ministers, what you'll find is most countries in the world recognize the only way that we're going to be able to meet the demands of the future is to have humans augmented by AI. And the only way to generate AI, especially that is tuned to a local country, is to take the data of the past in your country and put it in some sort of standard form. And so what we're doing is literally to country scale. I'm helping Denmark, Netherlands, Belgium, Norway, Sweden, as I mentioned, Singapore, South Korea. But interesting, we just went live in Ethiopia. And we're helping Kenya, Nigeria, and Pakistan put their data into an OMOP structure. And so it's fascinating because there is almost no argument from anyone in the world about the notion of data at rest being in a standard schema. You may, in fact, have to deal with a fair amount of data curation and normalization to get it there. There's some expense to do that. So interestingly enough, in some of the lower and middle income countries, I found philanthropy that will come and help that country put their data into a standard form so it can now be used for algorithmic development and validation. So yeah, it's a pretty global movement. I don't think, again, anyone would argue that if OMOP is data at rest, FIRE is data in motion. But the FIRE standard continues to evolve, and that's good. One of the things Mayo has done is worked with the HL7 colleagues to expand the FIRE standard itself using what's called an accelerator model, which is there's the base FIRE standard, FIRE R4, R5, but then you can extend it. And you can say, oh, I want to add genomics. I want to add digital pathology. And you then work with the standards organization. So ultimately, it gets validated and incorporated into the standard itself. So both at data at rest and both data at motion, we're trying to take a global view. And if you ask, how big should this be? We actually did an analysis of how many people on the planet Earth have an electronic health record today, October 2024. 4 billion. Wow. And so the goal is 4 billion patients empowered with AI that can help they and their families get the best care possible.
Advocates like Mayo and progressive sites and large vendors to kind of keep pressing on that, meaning the FIRE standards accelerator. It's really use cases, right? So it really comes down to, you need more flexibility, more data to cover more use cases. And I think that's part of the challenge that we have in today's, environment where you have HIT, you have some HIT companies bringing some really interesting, really progressive solutions to the market. But then when they try to get that data out of the EHR, and they try to use a current standard, it might fall short of what the data that they need. So it's good that we're moving that forward. So I want to shift gears a little bit, John, and get back to AI, right? So I'm seeing, like, many of my clients have AI technologies in place. Deepak, who we're going to listen to in a little bit, he helps HIT companies build tools, AI tools. I've had some conversations recently with some small and rural hospital CIOs and CMIOs, and they're starting to venture down that road of trying to get to automation. When you look at the landscape, John, right, you basically have the large institutions that have lots of resources at their disposal, and they can venture down those roads, make mistakes, get back online. But when you're talking about your small community hospitals, you talk about your rural hospitals, who are the ones who really need automation because staffing issues and because lack of just resources, right? And ironically, they have probably the least amount of IT resources to handle that. What kinds of advice and are there solutions that are out there that Mayo can help with? And what other kinds of advice do you have for those small rural hospitals who are trying to implement automation so they can augment basically the resources that they have as skeleton crews?
Well, a really good question. And I have 73 community hospitals that work closely with me. And the CEOs of community hospitals don't wake up saying, what I need is AI. They wake up saying, oh, my revenue targets they're really hard to reach. My staff is hard to recruit and retain, and there's a lot of burnout. And so what you start with is, well, what is the problem to solve? And then these community hospitals say, oh, I see, there may be a product out there like ambient listening that can help my physicians get their work done and get home sooner. Burnout will be reduced. Or maybe there's some administrative simplification solutions or clinical solutions that are going to just allow us to take a specialist, and that specialist can work at the top of their license, get more done, see more patients with less stress. And so that's the sort of question to ask first. Problem to solve, what products exist? And there are commercial products that will add right on top of the electronic health record. And as you point out, though, sometimes the products may not exist, and Mayo and some innovators build these things. And the reason that the CEO of Mayo moved the community hospitals of Mayo into my organization was because they then get first access to some of those innovations. So that is sometimes through affiliation, academic medical centers can help the community sites get the answers they need faster. And that's my role in bringing them these tools.
That I think that some of these organizations have too is they just don't know the resources that are out there that can kind of help them and guide them when it comes to what's going on. Sort of. I know that you're plugged into some of these quasi-government committees, etc., that are starting to really block and tackle some of these huge issues that are with AI. Some of the, like Chai, for instance, and I was wondering, perhaps you can give some folks some insight that might give them additional resources that they can kind of go to, listen to, read about, that might help them sort of in that maturity process.
Absolutely. I think everyone needs to remember you can't do this alone. You really need to do this working in partnership with collaborators. So 2 years ago, a number of us came together and said, how do we build a guiding coalition of government, academia, and industry will work together in a nonprofit context so that everyone can benefit from the early experiences, the lessons learned. So we formed this thing called the Coalition for Health AI. You'll find it at chai.org. If you go to that website, you'll find a lot of resources you can just download for free. Best practices and how to get these new products and services into your organization. What are the guidelines and guardrails? How do you make sure they're fair, appropriate, valid, effective, and safe? And then you draw on your peers. And they're now with these 4,000 organizations working together in Chai, a peer network where you could say, hey, what was your experience with this or that product or solving this or that problem? And that peer communication works really well. Again, not to endorse any company and organization, but I've been chatting with some of the organizations that we all know of, the membership organizations of this country, like HIMSS and Chime and that kind of thing. And they're increasingly thinking, this time of AI, it's a time for all of us to educate each other. And that should be more of a focus of any of the meetings these organizations have.
That's a great point, and I know that there's a number of those opportunities coming up. Health is around the corner. I know that Vive and HIMSS, I know there's a lot of activity there. I've seen that you're speaking, which is a shock, right? That you'll be up on the stage once again, John. Getting back to the Mayo platform specifically, I have a number of my clients that are working with you now. You've made a few announcements and just recently of some of the HIT companies that you're working with. Some of them like Extrago and MedTel and Doc Health were just announced recently. Specifically, how are you interacting with those organizations? What is it that you look at as your role for the Mayo Clinic platform when it is working with these vendors that you've chosen to partner with?
Absolutely. So we know in our startup community, there's incredible energy, enthusiasm, and innovation. But very often, these startups are lacking two things: a large corpus of de-identified data and clinical expertise. So the idea is Mayo started an accelerator. We've got about 40 companies in the accelerator. And for those companies that are early stage, bring them into the accelerator, help them with AI algorithm development and validation, deployment, and bring clinical oversight, making sure this will do no harm. So that's certainly one way we work. But also larger companies that could be multinational companies or pharma, very often, again, have great people, technology, but don't understand how to validate an algorithm. And so we can help them looking at the safety of their products, do post-market surveillance, or help them answer questions to design new therapies or new care models.
And how about when you talk about the Mayo Care platform in general, as you can see, I've gotten a ton of questions just about the organization itself, John. Is how are you broken down from a resource perspective? I'm not asking for the entire chain of command. What I'm asking for is like, how are you dividing out your resources for supporting the initiatives that you have right now, and where do you see that going in the future, in the near future?
Well, sure. So much of what I focus on day to day is not just Mayo, but truly global transformation and helping others around the world curate their data. And so, as you suggest, when you look at the organization that is Mayo Clinic Platform, one part of it works with solution developers, vendors, those in the HIT community, companies large and small. One part of it works with provider organizations to help accelerate their adoption of these solutions. And then we do have a fair amount of services that help us with things like legal compliance, privacy, making sure that across organizations and across countries, we're adhering to regulatory constraints and cultural expectations. So at the moment, the number is about 150 people working together on this endeavor, with the notion that if we can touch 4 billion people, that we will have achieved what is Mayo's primary objective, and that is the patient and the needs of the patient always come first.
And remind us what countries that your network has spread out to so far.
Well, so of course, there's a lot of collaborators in the United States, but also Canada and now South America, in Southeast Asia. We've done work already in Singapore. We're working on Thailand, Indonesia. We've got South Korea. We're even asking questions like, how do we work with colleagues in China in a way that is going to adhere to regulatory privacy protections, IP protections, and that kind of thing. And in Europe, I mentioned Denmark, Netherlands, Belgium, Norway, Sweden. And so with every passing day, there seems to be more interest at country scale in getting involved. But do remember, 85% of humans live in low and middle income countries. So really important, as I mentioned, that we get involved with sub-Saharan Africa. And today that's Ethiopia, Nigeria, Kenya. But we have 9 countries that we'll be working with in sub-Saharan Africa over the next year.
We've got a couple of minutes left. So what I want to do here, John, is just give you the floor and to impart any wisdom that you have. And remember, I'd say half of our crowd that we're listening today we have hospital provider sites. We also have HIT companies. Most of them joined today to learn more about the Mayo Clinic platform, but also just learn some secrets, tips, any advice, when talking about where do you go in your journey from here to be, most flexible to be able to implement and adopt these new technologies?
Well, sure. So a measure of our success should be adoption. And let me give you some wisdom from my Uber driver today. My Uber driver said, I read a lot about AI and I worry. Will it eliminate jobs? Do I have to be worried about my safety? Will it harm me in some fashion? So one of your first questions you should ask is, how do you build trust? How do you ensure that this AI revolution, which truly is a next industrial revolution, will do no harm? And so for us, that makes, a lot of communication and cultural transformation your first step. If you tell a clinician you will diagnose disease earlier, there will be less pain and less expense for your patients. Your quality of practice life will get better. You sort of say, oh, I see. This is augmenting my work, not replacing a doctor. And Coalition for Health AI and other organizations and government leaders around the world really are working on those guidelines, those guardrails to ensure there is no digital harm. So let's all work on trust. There will be data cards and model cards for every algorithm. What data were they developed from? How does that algorithm work across the old, the young, the male, the female, the rich, the poor? Transparency will also help build credibility as long as there's consistency and reliability. So I do truly think that this is a golden time and that every one of you should go deep and look at the AI possibilities for enhancing your organization.
Dr. Halamka, thank you so much for joining us. I know that you're coming from your Delta Lounge lives and you got a flight to catch, but we appreciate you taking a time to stop in between flights to spend some time with us and impart some wisdom.
Excellent. Well, hey, everybody, have a wonderful rest of your day, and turn it back to you, Larry.
All right, thank you, Dr. Halamka.